Is it reasonable to discuss the term remission in multiple sclerosis? If you'd like to hear my opinion, don't turn away, because that starts right now. Howdy! Thanks for learning about MS with me, Boster. I started this YouTube channel to help my own MS clinic patients learn between visits, and it's my hope that through these videos, I can help you learn too. Today's topic? The term remission in the setting of multiple sclerosis. Remission in my field is a very charged term. It's a term that has a lot of emotional attachment to it. You don't say remission casually when talking about multiple sclerosis. I find that this term is misused by a lot of people. People impacted by MS, families with MS, doctors treating MS. I also feel like a lot of people don't understand remission, and I just wanted to spend a few minutes on this video sharing my opinions. Now, the word remission has a very confusing history with multiple sclerosis. The most common form of MS is still to this day called relapsing remitting MS. Now, relapsing remitting MS gives the impression that there's periods of relapses, an attack, a flare, an exacerbation, and then there's periods of remission. And I've spoken to many doctors and other clinicians who, if the person's not having an attack, they think they're okay. They must be in remission. And even though they're having new change on their MRI, and even though they may be struggling with cognitive impairment or pathologic fatigue, well, they're not having an attack, and so it must be remitting. And that is a falsehood. And so I start this discussion off by reminding us that we have entered into a discussion about remission confused because of the past use of relapsing remitting MS. Now, I obviously don't care for this term, and I much prefer a more updated term, relapsing MS. We dropped that term remission, and we're talking about a disease where we can see relapses. But we do away with this arcane notion that in between relapses there's nothing bad going on. Now, before we go any further, I certainly think that we need to define remission. And I looked this up in the dictionary. And the definition that I liked the most was really a definition that says no evidence of disease activity for 5 years in the absence of treatment. So somebody hasn't received a therapy in a 5-year period, but there's no evidence of having disease. And that sounds like a heck of a good definition of remission to me. Now, clearly, remission does not mean cure. Those are different terms. A cure would suggest you're done for life, and remission does not. Remission means you've gone a very significant period, 5 years, and there's no evidence of disease, and you haven't been treated. Fine. I also want to point out that being on a continuous therapy and achieving disease stability for 5 years is also not the same thing as remission. If you're taking a medicine, and while taking this medicine continually, you've had 5 years with no disease activity, that is awesome. I mean, that's amazing. That's really, really, really good. But I wouldn't call that remission. I wouldn't call it remission because it's control of the disease. It's disease stability in the setting of treatment. And in that setting, I wouldn't want to take that therapy away because I would expect that we would then have a reemergence of the disease. And I just want to point out that just because something isn't remission doesn't mean it's not good, because achieving disease stability for 5 years on any therapy is amazing. But this video, I'm really trying to focus on the word remission. So let me try to unpack the word remission in multiple sclerosis. What might it mean to use the word remission? Let's try to operationalize it. So I like the idea of a 5-year period. I got that. And I like the idea in the absence of treatment. I like that. When we say no evidence of disease, let's be really specific about what we mean. So for starters, no attacks, no new spots on MRI, and no evidence of change on neurological examination or testing. So this is the NETA-3 concept. But I don't think that's enough to say that it's remission. I would love to add in normalization of brain shrinkage. People after the age of 18 have a planned, very slow shrinkage of their brain as they get older. That's normal. People with MS, as I've talked about on other videos, are at risk of having accelerated brain shrinkage. Sometimes 5, almost 10 times faster than normal, and that's really scary. and that correlates with bad things. And there are medicines we now know that slow the brain shrinkage, and some do it better than others. My point here is, when we create a concept of remission, I also feel we need to include brain volume loss or brain shrinkage. And I would like to say that in order to call it remission, in addition to no attacks, no new spots on MRI, no worsening on neurological testing or on exam, I want to add in normalization of brain volume loss. So the brain should age and shrink at a normal rate with the general population. Now, we could push the definition beyond that, and we could include things like no change on neuropsychometric testing, looking at detailed aspects of intelligence and cognition and things like that. We could include new emerging biomarkers like neurofilament light chain. So neurofilament light chain goes up when the disease is active. And so you could say seeing low levels of neurofilament light chain that remain low for 5 years. This is not a video where I'm trying to give you an answer. Instead, I'm really trying to discuss a concept. And I guess I'll close my operational definition of remission in MS as follows. 5 years in the absence of treatment where there's no evidence of disease activity, as defined by no attacks, no change on neurological testing or exam, no new or enlarged lesions on MRI, and normalization of brain volume. So there you have it, guys. My own personal opinions about the word remission in multiple sclerosis. It's my opinion that we need to use a common language, and I've shared with you today a definition that at least rings true for me as far as remission goes. I've also shared with you at least how I would like to operationalize this term in MS. And so now I would love to hear from you. What are your thoughts and opinions? What are your comments or questions? Please leave them in the section below, and I look forward to reading them and responding to them. My name's Boster, and again, thanks for learning about MS with me. If you like this video and you'd like to see more content from me, that's awesome. And please take a moment to subscribe to the channel and hit that notifications bell so you don't miss any of my upcoming content. I'm trying to release 1 to 2 videos each week. And until my next video, take care.